Hello, everyone. It's Monday, May the 10th, and I hope everyone had a wonderful Mother's Day. And you know, I hope we all took time to keep in prayer all the people that we've lost, and we've lost a lot of wonderful ladies that I'm sure were moms and grandmas and maybe even some great-grandmothers. And so with all that being said, you know, I'm sure that we were prayerful in thinking about those folks. And like I said, I hope everyone just had a great Mother's Day. With all that being said, we did lose 10 additional people. And you know, the reporting on the weekend sometimes can be a little light. So, you know, I'm sure hopeful that this number doesn't increase on Wednesday, but nevertheless, the 10 people that we've lost, the 2,720th death is an 86-year-old female from Monongalia County. The 2,721st death is a 59-year-old male from Kanawha County. The 2,722nd death is a 71-year-old female from Boone County. The 2,723rd death is a 71-year-old male from Raleigh County. The 2,724th death is a 68-year-old female from Kanawha County. The 2,725th death is a 73-year-old female from Ohio County. The 2,726th death is a 76-year-old male from Marshall County. The 2,727th death is a 91-year-old female from Berkeley County. The 2,728th death is a 74-year-old male from Wayne County. And the 2,729th death in West Virginia, 2,729 deaths, is a 63-year-old male from Kanawha County. 2,729 people. It's really a shame. We had 211 positives over the last 24 hours. We didn't test much at all. We had a positivity rate of 5.62. Our cumulative rate is at 5.14. Our active cases have dropped below 7,000. That's really good. It's just barely. It's 6,983. Our recovered cases are 146,905. You have 246 that are hospitalized and 78 in the ICU units. We picked up a different red county now, but we only have 2. That's Nicholas and Wayne. I continue to remind you over and over and over, if you're 65 years of age and you pick up this dreaded disease, or you pick up a feeling of a cold or tiredness or whatever it may be, a cough especially, temperature, go get tested. Please just go get tested. We can give you antibodies and save your life if we catch this early enough. You know, and the reality of it is in these days now, we're beginning to think we're coming out of this and everything's okay, but every day, right here's 10 more great West Virginians we've lost. You can avoid being one of those if you'll get vaccinated. You can avoid being one of these if you'll get tested and catch this thing early enough. From the standpoint of vaccine eligibility, all over 16 are eligible. It looks like 12 to 15-year-olds that the CDC is going to authorize that in the very near future. You know, we're ready. There's 78,000 of them in West Virginia. We're ready to go, and I caution people to listen to the experts, listen to everyone about vaccinating these kids and everything, and just weigh out your decision based on the experts and their medical opinion. I do encourage all those 16 to 35 years of age, come on now. We have to get you vaccinated. We have got to get you. And I continue to call on the parents and the grandparents to protect yourselves. Help us get those kids vaccinated. Those kids need protected. You need protected. And with all that being said, the kids, from the side effects that they could possibly get and everything from this, in every way need vaccinated. Please help us to continue to get those kids vaccinated. And we'll send them $100 and we're working in a lot of different ways on this. You know, Ann Erling, our deputy chief of staff, said to me the other day, we can go two ways. We can go with the people can get a savings bond, or you can go the other way to where we can go straight with a gift card, and we're working on that just as well. So we're working on both those right now, and the savings bond situation is going to be a little bit different. It'll be a true savings bond, but it'll be an electronic deal, but we'll set up how all that'll work and everything. But we're going to give people the flexibility to go two different ways. From a standpoint of our vaccine distribution update, we're at 85.3%. I liked it a whole lot more when we were at 102.4 or even 106.3. We're getting more doses out of the vials. We still are struggling to get to 100%, but we're trying to do that every week. We have now fully vaccinated all those 65 and above, and to the tune of 71.5% in our state. It's amazing. It's great stuff. We have over 80% in our call to arms, for our people 65 and above. That just is wonderful. We're at 54.9% of our total population has had one dose, and we're at 46.1% that is fully vaccinated. Now, with that being said, I think we're still right at the top as far as leading the nation in those that are fully vaccinated, but we're at 54.9% of our total population has one dose. And we want to continue to just ramp that up and everything. I think we can get to 65%. That's only 10%. We're close and everything, and I know that we'll be plenty close by June 20th when we get rid of the mask. So just help me get there, and we can get there, and it'll be really great for all West Virginians. From the standpoint of saving our wisdom and where I go back to, this is the one that I'm constantly looking at and so proud of. So proud of just this, that we got after vaccinating our folks that were the elderly. Started with 80 and drifted on down, but we now have in excess of 80% of our people that are 65 years of age that have been vaccinated. Now, with that being said, if we continue on this path of trying to get to 85, it will be an incredible success. Our goal of those 50 to 65 years of age is 75%. And we're dialing in to making sure that 65% of our total population gets vaccinated. I would tell everybody, listen, if your grandmas and your granddads and everything else like that have gone to get vaccinated and everything, and absolutely just not listen to all the rhetoric about all the bad things that could happen, how many of them have we saved? And please, you need to stand up for them. You need to stand up for all those, especially your grandparents or your great-grandmoms or dads and everything. So if you're 16 to 35, go get vaccinated. Please stand up. Please stand up and really help us to help everybody and to absolutely pay real tribute to all those that we lost. As far as our businesses, manufacturing, and church outreach, please just call us and everything. We'll come. We'll set up a vaccination clinic there. Do your employees, do the congregation, do whomever and everything. We'll come if you'll just call. From the standpoint of our COVID-19 vaccine info line, it's all up there. The vaccine reminders, I've said it over and over. Quit paying attention to these people that, misery loves company. I've said this a bunch of times. Misery loves company. And those that are sitting out there saying, by God, I'm not getting a shot and everything, those people are recruiting you to be with them because misery loves company. All of the science, all the medical experts, all that I could possibly tell you, there's no chance that Jim Justice would ever try to encourage you if I had doubt. But I have doubt if you don't get this, if you don't get this vaccination, you're going to have real trouble. So with all that being said, please, please go get the vaccinations. The free testing's all up. You've got it all there. Our special thanks again to Walgreens and Fruth for what all they've done. It's good work, and I really appreciate them. From a standpoint of our outbreaks, we have 16 in our long-term care facilities and 9 in our churches and in 7 counties. Those 7 counties, Berkeley, Grant, Greenbrier, Hardy, Jackson, Nicholas, and Ritchie counties, we got to buckle up a little bit in our church community and really watch what we're doing. We got to buckle up a little bit more in our long-term care facilities as well, because this thing can be really tough there. So really, please help me watch there. Wear your mask. Stay a pew in between you in our churches. Absolutely, comply to all the social distancing and just watch yourself. Just really watch yourself. This thing's not over, but we're close. We're really, really close. You can either contribute to it being over, or you contribute to the whiplash that causes us an elongated issue and an elongated problem. At Corrections, we have 8 inmate cases and 12 staff. Way to go, Corrections. Great stuff. In our Call to Arms initiative that we did last Friday, I want to tell you that our mask mandate, this will be lifted on our birthday, June the 20th. We'll get rid of that. 158 years West Virginia's been around. These masks and all this have been around too long. They've been around absolutely probably now going on, 14 months or whatever. And by that time, of June the 20th, we'll have in place many of our 16 to 35-year-olds that we will be have been vaccinated, as well as probably a bunch of our 12 to 15-year-olds, because they'll be probably brought online. They're not that yet, but it sure looks like that's where we're going. What we want to do is get to a 65% of West Virginians that are either 16 or older or 12 and older, depending on how many are eligible or who is eligible once the mandates are lifted from the federal government. We want to be at 75% of all those that are over 50. And we want to be at 85% of all those that are over 65. We won't necessarily change our mind in any way in regard to the mask, because we'll be close. But that's the goal. And absolutely every time I've asked you and put a goal in front of you, West Virginia, you've responded. So try to get us there if you can. Right now it remains mandatory that we still wear a mask in our public buildings and everything. And I ask you over and over and over about giving blood. If by chance you have recovered from this dreaded disease and everything, which many, 2,729 did not. And if you have, it seems to me like you have an obligation at least to consider the possibility of giving blood. We need it. We really need it. From the standpoint of our state parks vaccinations, we're on our way there. As part of the ongoing efforts to get more West Virginians vaccinated, we're going to hold free vaccine clinics at all West Virginia state parks between now and Memorial Day weekend. On Memorial Day, all the state parks and forests will offer vaccines to employees, families, and park guests, and all the details will be up on our www.stateparks.com. Get this, we're having a job fair for the West Virginia State Park System, and they'll host it tomorrow on May the 11th to recruit people for jobs at the parks. The job fair is hosted in partnership with the DNR and Workforce West Virginia. Those who want to participate in the virtual job fair should visit the website on screen or head over to Pipestem State Park tomorrow. Now, what is really great about this is we continue to recruit people and everything for jobs. It's a good thing. And, and I am happy to see it, because every time we have more and more jobs to offer, At the end of the day, if we'll absolutely just stay on our game, we'll have more and more and more people come to West Virginia. Okay, from the standpoint of our bond credit ratings, we've been through all the discussions. You know, I've been on the phone with them over and over and over and everything, our revenue department, on and on and on. And I am very, very pleased to report that we now have been approved from the standpoint on all three agencies, that's Moody's, Fitch, and S&P, to where our bond ratings state exactly what it has been in the past. And that's terrific news, because for all practical purposes, we're AA stable. That's so good, it's unbelievable. Many, many people coming through this terrible pandemic cannot absolutely just sit back and say that they were absolutely approved by all three of these agencies in a way that kept us the same, and we want to just continue to try to make that even better. In addition to that, we're going to the marketplace with our last bond offering and everything. That's going in, I think the date was June the 2nd. You know, that's our Road to Prosperity bonds. And the last go round, we generated a premium on a bond that sold. The bond sold for $746.5 million, but we generated a premium above the bond of $146,500,000. We're hopeful for some level of premium. I don't really think we're going to reach that level, but I'm hopeful that we have a premium on this bond letting as well. So nevertheless, we're approved, stable. Everything was great as far as the bond agencies, and why wouldn't it be? Why wouldn't it be? We have just been moving ourselves forward in West Virginia for a good time now, and I'm very, very proud of all those that have put in the licks to make all that happen. And we'll continue to do more and more and more road work. And as we continue to do more and more road work, our goal is just to do this. Our goal is to have the best roads. Our goal is not to have what we've had in the past. I mean, you know, I've said it over and over. These roads didn't get in this shape on my watch. But what's going to happen on my watch, we're going to get the roads in great shape. Nevertheless, that's all I've got. Thank you so much.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. As the Governor pointed out, we are working with all of our partners at the State Department of Education, county boards, local health departments, and other providers, and we are ready to go once the approval is given for 12 to 15-year-olds. What we will be doing, as the Governor pointed out, is we will make shots available for 12 to 15-year-olds. We will continue to make shots available for 16 to 18, and we will make those available for family members when we do events at schools or in counties. In addition to that, a couple other items that we're moving forward on is this week, primary care providers will start to pick up doses to be used in their practices. We have primary care providers continuing to sign up. We know that there are people out there still waiting to make a choice on vaccine based on understanding from their primary care provider the value and safety of the shot. So we're making those available in that form. Also, hospitals are now, where appropriate for those patients being discharged, making vaccines available to patients as they discharge from hospitals. As the Governor pointed out, fairs, festivals, local businesses, community groups, wherever we need to help coordinate vaccine distribution, we will do that there. Last thing I'd leave you with, as I talked about this Friday, I grew up in a family of military service. I heard the stories of my grandparents and that greatest generation and the sacrifices they made during World War II. Understand that over 160,000 more people have died from COVID than died in the 4+ years that our nation fought in World War II to deal with that threat. Nobody is trying to infringe on anybody's rights, what we are asking you to do is take on the responsibility that that generation took on and get a vaccine to protect you, but more importantly, to protect the people around you and your community. I greatly appreciate the work that's being done by local health departments, DHHR, the National Guard, all the other people that are stepping up. And on behalf of all those folks, we would ask that you take on consideration of your responsibility to get a vaccine and help protect our community. Thank you.
Thank you, sir. We'll now go to Secretary Bill Crouch with the DHHR.
Thank you, Jordan. Good morning, everyone. This week, we join advocates across the nation in emphasizing the importance of substance use prevention and positive mental health as a part of National Prevention Week. This is a key initiative at DHHR, not only during this week, but year-round. We encourage individuals and families to take this opportunity to learn about prevention, treatment, and recovery options. 1-844-ATLP4WV is a 24/7 call, chat, or text line, and it's a great resource to provide immediate help from any West Virginian struggling with an addiction or mental health issue. Residents can also check out helpandhopewv.org for prevention resources and tips. We must also remember suicide can touch anyone, anywhere, and at any time. Learn more at preventsuicidewv.com. The National Suicide Prevention Lifeline is available 24/7. That is 1-800-273-TALK. TALK, or 8255. That is 1-800-273-8255. Thank you.
Thank you, Secretary. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. I do want to remind everyone about the benefits of the COVID-19 vaccine, that it is very safe and effective in saving lives. There is a lot of misinformation out there, and we do want to make sure that people know that there is proper information out there on the CDC website as well as our website, but it does save lives, and it also allows you to do things that you haven't been allowed to do in the past. You know, you are allowed to spend time with family and friends without your masks on. You can do a lot of other things that you've not been able to enjoy in the past. So we do encourage people to take advantage of the vaccines. We have plenty of vaccines available in West Virginia right now. We are able to take the vaccines to many places that not able to before. We have mobile clinics available. So please reach out to us if you are interested in getting the vaccine. Also, our testing events, we have a lot of free testing available in West Virginia. So if you're sick or have a cold or anything that you're not sure about, we do encourage you to take advantage of these events that we have in West Virginia. Please do so. It's on our website as well. Thanks, Jordan.
Thank you, Dr. Amjad. Dr. Clay Marsh, our coronavirus czar, had a prior engagement today, and he will rejoin us on Wednesday. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask about our vaccination administration rate. Like the governor said, we're at 85.3%. I was wondering, do we anticipate that going back up as we roll out some of these initiatives like getting shots to primary care providers, or are we considering adjusting what we're asking the federal government for? Thank you.
Well, Charles, let me just answer it, and this is going to be a short answer, but Charles, that's the whole objective to everything we're trying to do as far as the marketing and the effort that's going in to try to get people to come and to get their vaccines. We're doing everything from mobile units that are going to the people to offering the $100 for whether it be savings bonds or whether it be a gift card or whatever. But we're doing everything, as far as a campaign, from the standpoint of how we go about trying to get the word to the people. But the biggest thing, Charles, that you either do one of two things. You either just sit on your hands and say, well, there's a lot of people out there that are still wanting to get the vaccine, but it's just inconvenient for them to do. So we're just going to sit on our hands and hope they come in. Well, you don't do that. You go to them. You try to make it convenient for them and everything. They ought to come on their own. We get that. But in all honesty, you've got to go to them because you know that every person that you vaccinate, you could very well save a bunch of lives. And so we're trying that, and we're trying to work on that. We're trying to entice people to do more from the standpoint of the 16 to 35-year-olds, from the standpoint of the savings bond effort or whatever it may be. All the different things, from going to the fairs and the festivals to the gold and blue game to on and on and on. We're going to continue the effort because, Charles, the alternative is just to sit back on our hands and say, well, we've done all we can do. We've done all the very best we can, but that ain't going to cut it, is it? So we just got to keep after it, and we're very, very hopeful that the harder we work at it and everything, the more people we're going to get vaccinated and the more people we're going to end up saving lives.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good morning, everyone, Governor and staff and fellow reporters. First, an announcement. The church I attend, First Presbyterian Church of St. Albans, in partnership with the City of St. Albans and the St. Albans Ministerial Alliance, which is a consortium of churches, will be hosting a free vaccination clinic Friday, June 4th from noon to 6 p.m., not just for anybody in St. Albans. Anybody in West Virginia wants to come and get their shots. It'll be a drive-through event at First Presbyterian Church, which has a huge parking lot for such things. And Dr. Sherry Young is coordinating with us with the Charleston Kanawha Health Department. It's a very seamless process. I put that out there because all we did was ask and it got set up. It's that easy. Really one phone call, one visit away. Let me get to my question now. To Secretary Bill Crouch, and probably Dr. Amjad can address this too. In counting the numbers, we get these numbers saying West Virginia has a record number of overdose deaths, and other mental health issues. Aside from the quantitative part of it, are we getting some qualitative data in terms of interviewing some of the people that have overdosed and drilling down and finding out, was it stress from COVID? Was it stress from losing your job that prompted you to relapse and go back to using again? And how much can we tie the pandemic to the uptick in mental illness, uptick in overdoses, and the deaths?
Okay, before we go to Secretary Crouch and Dr. Amjad, let me say this, and this is just a thanks to Mark. I mean, by him stepping up, by his station stepping up, by the broadcasters across the state and everything stepping up and saying, we're going to really try to help here. And by him saying to us, that any West Virginian can come and get tested and all that stuff, Mark, thank you. I mean, that's all I can say. Thank you and thanks to all the broadcasters, because this is helping. It's really, really helping. But anyway, Dr. Amjad and Secretary Crouch, if you can answer all the other stuff about this terrible killer, also the drugs. So answer that, please.
Thank you. Thank you, Governor. And thank you, Mark. I'll start and then you can add to what I have to say. It's an important issue and an important question. As you probably remember from previous years, we get our toxicology reports very late. Those have to be sent out. We wait for those. That gives us some indication of the type of drugs that the individuals were taking and what they overdosed on. We get overdose reports monthly that are put on the DHHR website. The issue of what causes people to use drugs, there is a lot of information out there. We have quick response teams throughout the state who actually go to people's homes when they overdose and they don't die, and talk to them about getting into recovery, getting into treatment. We want to get to those folks and get them care and get them help. This pandemic, you've alluded to, certainly have absolutely contributed to the increase in overdose deaths, not in West Virginia, not just in West Virginia, but across the state. There's some significant numbers across the country with regard to overdose deaths. A lot in Appalachia. As past years, Appalachia, Kentucky, other states are high and leading the nation. So your point is critical. Why do people use drugs? Loneliness, the inability to cope, having nowhere to turn, the issues that we talk about a lot daily, not just in these press briefings. The numbers we showed earlier are individuals and entities that can help and can provide someone to talk to. So I like your question and I appreciate it, Mark, and we're going to do a little more work on that. Ann, you want to add anything to that?
The only thing I'll add to that, Mark, is that, the opioid problem as well as the mental health problem is very important to us at DHHR as well as the governor's office. So we're working with our behavioral health unit as well as comprehensive care clinics across the state. So we are addressing that heavily, and we've been focused on that even throughout the COVID-19 pandemic. So we'll be addressing that along with multiple, entities throughout the state. But we've been focusing on that throughout the past couple of months as well. But that's all I'll add to that. Thanks.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Would like to report I received my Johnson & Johnson vaccine on Saturday, and so far, so good. No reaction and no pain in the shoulder either. So there we go. Governor, I wanted to veer off COVID-19 for a second to the cyber attack on the pipeline. And if you've gotten any word from your advisors on how bad the gasoline pain at the pump is going to be in West Virginia, and if you have any plans to talk to President Biden about releasing any of the strategic reserve in the next couple of days. Thank you.
Paul, I don't have a great deal of information on this, but we'll continue to solicit information and get information as it comes in. We will get some kind of bump, whether it's artificial or realistic, will be, argumentative, but because everybody takes advantage of these things. I mean, from the standpoint of, you have a disruption like this, maybe the disruption really doesn't have anything to do with supplies, but yet you see a jump in the prices, and that can be driven by just people taking advantage, not our local stations, but the big oil companies or whatever like that taking advantage of a situation where they can bump it up some. But I'll have more information in the days ahead. But right now, I don't have any plans to urge, our president as far as the strategic oil supplies and everything. But like I said, I'll have more plans, and congratulations on the fact that you got your shot. Thank goodness you did and everything. And thanks for telling everybody that, because that's just going to encourage somebody else to do the same.
All right, thank you, Paul. Next to David Beard with the Dominion Post.
Hi. I'm going to compile a few requests I've received from people who are interested in seeing some additional data, whichever is the plural, on the dashboard. One of them is you post vaccine numbers for ages 16 to 24 and 25 to 34. Could you add percentages to that so we could see how far along you are for getting that whole group vaccinated? Another one is it possible to post positive cases by variant so we can see kind of county by county what's going on in that direction, whether it's the regular COVID or one of the UK or whatever. And the third part is, I'm going to go blank on that, down to the county on, well, I'll just leave that because I suddenly went blank of what the request was. I'll pass it along a different day, but is it possible to get at least those two things on there? Thanks.
Well, David, listen, thank you so much for forgetting something, because gracious sakes, it happens all the time to all of us and everything, but and I don't mean that in any bad way, but goodness, there's surely no apology needed on that. We all got a lot on our minds, and this has been an incredibly stressful time, and so it's taken up a lot of brain power, that's for sure. But Secretary Crouch, if you could answer the stuff on the dashboard, that'd be good.
Yes, sir, Governor. Thank you, David. The variant information is on the dashboard. That was placed on the dashboard early last week. On the the overview tab, on the very first tab when the dashboard comes up, there is a yellow box that you can click to review variant data. That is by county. That was specifically done at the request of of a variety of individuals, but the press brought that to our attention. We placed that on the dashboard earlier last week. The information on percentages, I certainly will look at doing that. The issue with this dashboard, and our folks do such a great job on it, is real estate, how much you can get into a certain amount of space. So sometimes there are things we'd like to put on there that we aren't able to just because of space, but we'll take a look at that and see if we can add it. So good question. Thank you, David.
All right, thank you, David. Governor, I'll turn it back to you to close out.
Well, the only really thing I have to close out on is just this. You know, I always listen to everybody on the call. I appreciate all the questions and everything, especially questions that, you know, are related to COVID and not just goofball questions. But nevertheless, I go back to our general, and I go back to his statement, and I want to bring that back in front of you just 1 second. There's been more than 160,000 Americans that have died with COVID than there was that died in World War II in 4 years. It's amazing. More than 160,000 have died in 14 months that have died in all of World War II. Now, many of you out there can still remember what was going on in World War II. And really and truly, as you remember, if you don't remember from life itself, you can remember from the history books how everybody stepped up. All those that went to war, all those that left their homes and their families, all the moms that stepped up trying to make clothes or any and everything, all the stepping up that West Virginia did to produce coal, to absolutely make steel for our tanks, and on and on and on. Now, we stepped up, America. We stepped up because we were threatened in this country to lose the very values that we all have. And just think of how that generation just stepped up at a time that we needed them so badly. Now just think, all we're asking you to do, because we have more dead than we lost in all that war, all we are asking you to do to stop this war is go get vaccinated. Protect yourself. Protect those around you. You know, absolutely be a patriot. Be a patriot that was like all those that came before you. Absolutely, the general is splitting the bullseye, in my opinion. Absolutely, you have everybody encouraging you in all the news. Now we ask you to be a patriot, to step up. Absolutely step up to where we can shut this thing down. We need you. We need you. You can tell in my voice and everything, all of us have given everything that we had, and we're going to continue to do exactly just that. But we got to have you. We've got to have you in every way. Thank you so much.